Marcel. Hi.
Morning.
Okay, so today I'm here to ask you about healthcare. But first off, I just want to get some general information, background information. So, what do you do for a living?
I work in finance. I structure debt and equity for commercial real estate. So it's basically called structured finance.
Okay.
I help investors and private equity funds put together the money they need to acquire buildings, whether they be retail, office, industrial, and apartment buildings.
Okay, thank you. So one other question is, what do you think about America's current health insurance?
I would change the way that we have our outcomes set up. No payment is linked to any safety, service, or value. So basically, you're encouraged as a doctor or healthcare provider to make sure that your patient stays sick. And that's the only way you make money. Whereas if we had a system that pays you to keep your patients well, the cost of healthcare would probably go down.
Okay. All right, is that the only thing you would change about healthcare, or is there something else?
I think that with that, keeping that in mind, I think that then you'd probably be able to avoid a lot of the problems that we have right now, where you have the healthcare system is basically kind of composed of three parts. You have the patient, you have the doctor, and you have the healthcare insurance companies, and the patient is stuck in the middle. If you look at other healthcare systems around the world, that's not really how it works. In fact, you could see that all they have to worry about is making sure that they try to stay healthy. The doctors don't have to worry about working half of their work week dealing with the insurance companies and half the work week trying to see patients.
Okay. So, with all that above, do you yourself have health insurance?
I do.
Why is that?
Because there's pretty big ticket items. If I were to get really ill or needed surgery that I would probably not be able to afford. And in fact, it's one of the leading causes of bankruptcy here in the United States. People cannot afford to be without health care if they ever get sick.
Okay. And then, what is your opinion on Obama's healthcare proposal, also known as Obamacare?
Obamacare is, in the beginning, when he first came into his presidency, was kind of used as a pejorative, much like Hillary Care. People would kind of use it as a way of saying this is very wasteful, you're being forced to buy insurance that you don't need. I think that, if anything, it's keeping the conversation about healthcare in the forefront. I think that if you're a Democrat or Republican or independent, you're being forced to really talk about the issue, which is the fact that healthcare here in the United States is not affordable. And the way that people approach their healthcare needs to be changed. For a person who doesn't have healthcare, they don't go see a doctor until they have to, until they're really ill or they have an accident of some kind. And the only time you go see a doctor is in the emergency room, which is probably the highest cost of healthcare you could find anywhere in the United States. Whereas if you went directly to a doctor because you did your annual checkups, you want to make sure that you were okay, you can avoid a lot of issues throughout your life cycle.
Okay. And do you think America should follow in Canada's footsteps and make healthcare free for all American citizens?
That's kind of a misnomer there. Canadian healthcare is not free. In fact, they have similar to what we have here, which is a Medicare, but it only covers about 70% of their actual healthcare cost. The other 30% is borne by them. So most of the big ticket items, surgery, an ambulance, going into urgent healthcare is mostly covered, but you also are responsible for example, your prescriptions, certain doctor visits. So, the upside is, like I said before, the patient is left out of the billing cycle, which I think is really important. I think also when you look at a doctor who goes into medicine, an individual who goes into medicine in Canada versus somebody here, you graduate with lot of debt here, a lot of student loans. So you have an incentive you need to make a lot of money in order to pay off your bills and have a certain lifestyle that is expected because you're a doctor. Doctors in Canada probably graduate with less than half of the kind of debt that we would graduate from here. And there's not so much of an incentive to have to make a lot of money. You make a decent living and you focus on dealing with your patients versus a doctor here in the United States. You probably spend half of their time dealing with insurance companies trying to get paid.
My last question for you is, do you think making health insurance mandatory for businesses to purchase for employees would create a greater financial burden for the company?
I think this kind of goes back to your initial question. I think that there are no linkages between the knowledge that's out there. There's guys who are innovators that are creating new medical devices, new vaccines, things of that nature. There's not a whole lot of connectivity to what's going on with the insurance companies and what's going on with the doctors. So you could probably have a really innovative company next door to the doctor and the insurance company, and they wouldn't know about it, that they're creating, the cure for cancer, ways to deliver immunizations. Bill Gates spent billions of dollars trying to deliver immunizations to people in Africa. Well, it never happened. And the reason why was because there was no vehicle to be able to deliver those immunizations effectively to make sure that people were actually getting the shot they needed to be healthy. So I think that I would just change the way how we approach healthcare in terms of people think that it's, you have to be sick in order to get paid. And I would change it around where there'd be some kind of value to keeping your patients well. Regardless, nobody wants to be a patient. Nobody says, even if I live next door to the best hospital in the world, I really don't want to be there. That's where sick people are. I want to be well. I want to be living my life as best as I can. And I think that if we take that approach versus just figuring out, ways to overuse healthcare, which I think is the case here in the United States, you go in, and because you're paying such a high premium, you are being forced to say, well, if I'm paying $300 or $400 a month, I'm going to get every dollar's worth that I can. So give me drugs, give me a referral to another doctor, I want to see a specialist, and that kind of thing. You don't see that, in fact, in Canada. So you see your doctor, the guy says, yeah, you're sick, and here's your prescription, now go home. And you take his or her word for it, versus here, it's just that, you second guess everybody, and you want the maximum amount of health care that you can get from somebody.
Okay. All right, thank you. You have a good day.
Okay.